Welcome to the Transplant Institute at Methodist Dallas Kidney Transplant Education video series. This video will go into more detail about the transplant evaluation consultations and also discuss insurance and the financial expectations of patients having a transplant. As part of your transplant evaluation, you will undergo a number of consultations with various medical professionals. Let's take a closer look at what to expect during these visits. The first consultation will be with your transplant coordinator, who will meet with you and your family to provide education regarding the transplant evaluation process you are about to go through, transplant surgery, and post-operative care. The consultation with a dietitian will focus on reviewing your nutritional status and performing a frailty assessment to determine if there is a need for physical therapy to increase your strength for transplant. The consultation with a transplant nephrologist will focus on your medical history, discussing the medical risks of transplant, and performing a physical exam. The consultation with an infectious disease doctor will focus on any present or past exposure to infectious diseases that may need to be addressed before or after transplant. The consultation with a transplant surgeon will focus on reviewing your surgical history and discussing the surgical risk of transplantation. The consultation with your transplant social worker will help the transplant team get to know you as a patient, ensure that you have a strong psychological understanding of transplantation, and have the necessary social support to be considered a good candidate for a kidney transplant. To do this, you will undergo a psychosocial evaluation, which will feel much like an interview. You will be asked questions related to your medical and social history, including questions about your mental health and substance use, your family's medical and social history, dialysis compliance, insurance, financial resources, and employment. Let's move on to one of the most overlooked areas of preparing for a kidney transplant, having a support system care plan. Patients will be required to provide names and contact information for family and friends who are able to assist them before and after transplant surgery. Caregivers must be able to provide transportation to and from the hospital and appointments, assist with discharge instructions after surgery, and, if needed, assist with your daily care as you recover. If you live more than 120 miles from Methodist Dallas Medical Center, you must commit to staying in the Dallas area with one or more caregivers for 4 to 6 weeks. You and your family are responsible for making and funding lodging arrangements. Your social worker can assist by providing information on hotels with discounted rates for our patients. Some insurance plans provide lodging assistance. Your social worker will contact your insurance provider to inquire if this benefit is available for you. We encourage patients to have at least $2,000 available for their immediate post-transplant needs, which may include lodging, transportation, and food expenses. The financial expectations associated with kidney transplantation are substantial. All patients applying for a transplant must have long-term access to health insurance, prescription medication coverage, and the financial resources to ensure the lifelong maintenance of their transplant. We encourage our patients to not feel overwhelmed by these factors. Your social worker will work closely with you and your family to understand the details of your financial responsibilities and the financial assistance options available to you. Thank you for watching. To continue learning more about kidney transplant at Methodist Dallas Medical Center, please view all of our education videos.